Empowering children with ADHD, strategies, treatments and collaborative support for success. Childhood attention deficit hyperactivity disorder, ADHD, is a prevalent and often misunderstood neurodevelopmental disorder. Affecting millions of children worldwide, it can have profound implications on a child's academic performance, social interactions, and overall well-being. This video aims to thoroughly understand childhood ADHD, its symptoms, causes, diagnosis, treatment options, and ways to support children living with this condition. ADHD is a condition characterized by persistent patterns of inattention, hyperactivity, and impulsivity that are more severe than typically observed in children of the same developmental level. Its symptoms can interfere with a child's ability to function effectively in various settings, including home, school, and social environments. ADHD symptoms are generally categorized into two main types: inattention and hyperactivity or impulsivity. Children with this disorder may exhibit symptoms from one or both categories. Inattention. 1. Difficulty sustaining attention. Children with this condition often struggle to focus on tasks or play activities. They may quickly lose interest and move on to other things. 2. Careless mistakes. These children may make frequent errors in schoolwork or other activities, often because they rush through tasks or fail to pay close attention to details. 3. Listening challenges. It may seem like they are not listening when spoken to directly, even when there is no apparent distraction. 4. Incomplete tasks. They may start tasks but fail to complete them, moving on to new activities before finishing the previous ones. 5. Organizational difficulties. Children with ADHD often find it hard to organize tasks and activities, leading to messy workspaces and difficulty managing time. 6. Avoidance of mental effort. They may avoid or dislike tasks that require sustained mental effort, such as homework or long-term projects. 7. Losing items. Frequently misplacing items needed for tasks, such as school supplies, toys, or books, is common. 8. Easily distracted. They are easily distracted by extraneous stimuli, making it hard to stay on task. 9. Forgetfulness. Children with this problem often forget daily activities and routines, such as chores or appointments. Hyperactivity and impulsivity. 1. Fidgeting and squirming. Children with ADHD may fidget with their hands or feet or squirm in their seats. 2. Inability to stay seated. They may find it challenging to remain seated in situations where it is expected, such as in the classroom or at the dinner table. 3. Running or climbing inappropriately. There may be instances where these children run or climb in inappropriate situations. 4. Difficulty playing quietly. They may have trouble engaging in activities quietly, often talking excessively or making noise. 5. On the go. Children with ADHD often seem to be perpetually in motion, as if driven by a motor. 6. Excessive talking. They may talk excessively and find it hard to wait for their turn in conversations. 7. Blurting out answers. These children might blurt out answers before questions are fully asked, indicating impulsivity. 8. Difficulty waiting turn. They may struggle to wait their turn in games or group situations. 9. Interrupting or intruding. They often interrupt others or intrude on conversations or games, finding it hard to respect boundaries. Causes of ADHD. The exact cause of this disorder remains unknown, but research suggests that a combination of genetic, neurological, and environmental factors contribute to its development. Genetic factors. ADHD tends to run in families, indicating a strong genetic component. Studies have shown that children with a parent or sibling with this issue are more likely to develop the disorder. Neurological factors. Brain imaging studies have revealed differences in the structure and function of the brains of individuals with ADHD, compared to those without the disorder. These differences are primarily observed in areas of the brain involved in attention, impulse control, and executive function. Environmental factors. Certain environmental factors, such as prenatal exposure to tobacco, alcohol, or drugs, low birth weight, and early exposure to lead, have been associated with an increased risk of developing ADHD. Diagnosing ADHD involves a comprehensive evaluation process, typically conducted by a pediatrician, psychologist, or psychiatrist with expertise in the disorder. The evaluation includes the following steps. 1. Clinical interview. A detailed interview with the child, parents, and sometimes teachers or caregivers to gather information about the child's behavior and symptoms. 2. Behavioral assessments. Standardized behavior rating scales and checklists completed by parents, teachers, and the child to assess the frequency and severity of symptoms. 3. Medical examination. A physical exam to rule out other medical conditions that may cause similar symptoms, such as vision or hearing problems, sleep disorders, or thyroid issues. 4. Developmental and psychological assessment. An evaluation of the child's cognitive, academic, and social functioning to identify any coexisting conditions or learning disabilities. Treatment options for ADHD. While there is no cure for it, various treatment options can help manage symptoms and improve a child's quality of life. A combination of medication, behavioral therapy, educational support, and lifestyle changes is often the most effective approach. Medication. Stimulant medications, such as methylphenidate, Ritalin, Concerta, and amphetamines, Adderall, Vyvanse, are the most commonly prescribed medications for ADHD. These medications help increase attention and focus by enhancing the activity of certain neurotransmitters in the brain. Non-stimulant medications, such as atomoxetine, Strattera, and guanfacine, Intuniv, may also be prescribed, especially for children who do not respond well to stimulants or experience significant side effects. Behavioral therapy. Behavioral therapy, particularly behavior modification techniques, can help children with ADHD learn to manage their symptoms and develop coping strategies. This type of therapy often involves parent training, teaching parents techniques to manage their child's behavior, such as positive reinforcement, consistent routines, and effective discipline strategies. Social skills training, helping children develop appropriate social behaviors and improve their interactions with peers. Cognitive behavioral therapy, CBT, addressing negative thought patterns and behaviors, helping children develop problem-solving skills and improve self-control. Educational support. Children with this disorder often benefit from educational accommodations and support to help them succeed in school. These may include individualized education programs, IEPs, tailored educational plans that outline specific goals and accommodations for children with the condition. 504 plans, formal plans that provide accommodations, such as extended time on tests, preferential seating, or modified assignments, to support children with ADHD in the classroom. Classroom strategies, implementing strategies like breaking tasks into smaller steps, providing frequent breaks, and using visual aids to help children stay focused and organized. Lifestyle changes. In addition to medication and therapy, certain lifestyle changes can help manage its symptoms. Healthy diet. A balanced diet rich in fruits, vegetables, whole grains, and lean proteins can support overall brain health and functioning. Regular exercise. Physical activity has been shown to improve attention, reduce hyperactivity, and enhance mood in children with this disorder. Consistent routine. Establishing a consistent daily routine can help these children feel more secure and manage their time more effectively. Adequate sleep. Ensuring children get enough sleep is crucial, as sleep deprivation can exacerbate symptoms. Supporting children with ADHD. Parents, teachers, and caregivers play a vital role in supporting them. Here are some practical tips to help children with this condition to thrive at home. 1. Create a structured environment. Establish a consistent routine for daily activities, including homework, chores, meals, and bedtime. 2. Use positive reinforcement. Encourage and reward positive behavior with praise, rewards, or privileges. 3. Set clear expectations. Communicate expectations clearly and provide specific instructions for tasks and behaviors. 4. Break tasks into manageable steps. Help children manage tasks by breaking them down into smaller, more manageable steps. 5. Encourage physical activity. Provide opportunities for regular physical activity to help reduce hyperactivity and improve focus. At school. 1. Collaborate with teachers. Work closely with teachers to develop and implement strategies that support the child's learning and behavior in the classroom. 2. Provide accommodations. Advocate for educational accommodations, such as extra time on tests, preferential seating, or modified assignments, to help the child succeed. 3. Monitor progress. Regularly monitor the child's academic and behavioral progress and adjust strategies as needed. 4. Use visual aids. Incorporate visual aids, such as charts, schedules, and checklists, to help the child stay organized and focused. 5. Foster a positive learning environment. Create a supportive and encouraging classroom environment that recognizes and celebrates the child's strengths and achievements. In social settings. 1. Teach social skills. Help children develop social skills by teaching them how to initiate and maintain conversations, take turns, and read social cues. 2. Facilitate friendships. Encourage playdates and group activities to help children develop friendships and improve social interactions. 3. Model appropriate behavior. Model appropriate social behavior and provide guidance and feedback to help children learn from their interactions. 4. Provide supervised activities. Engage children in supervised activities that promote teamwork, cooperation, and positive social interactions. 5. Build self-esteem. Encourage activities and hobbies that the child enjoys and excels in to build self-esteem and confidence. If you found value in this video, please give it a thumbs up, like and subscribe to support this channel. Please share across social media platforms to reach a wider audience. Personal anecdote. Living with childhood ADHD. Growing up with this disorder, I experienced many of the challenges described above. My parents and teachers were often frustrated by my inability to focus and my impulsive behavior. School was particularly difficult, as I struggled to complete assignments and often disrupted the classroom. However, with the right support, I was able to manage my symptoms and succeed. My parents worked closely with my teachers to develop a structured routine and implement strategies that helped me stay organized and focused. They also enrolled me in a social skills group, where I learned how to interact with my peers more effectively. Medication played a significant role in helping me manage my symptoms. With the guidance of a pediatrician, we found a medication that worked well for me with minimal side effects. The combination of medication, behavioral therapy, and educational support made a significant difference in my ability to function and succeed. Looking back, I realize how crucial the support of my parents, teachers, and healthcare providers was in helping me navigate the challenges of ADHD. Their patience, understanding, and dedication provided me with the tools and strategies I needed to thrive. Childhood ADHD is a complex and multifaceted disorder that requires a comprehensive and individualized approach to management. By understanding the symptoms, causes, diagnosis, and treatment options, parents, teachers, and caregivers can provide the necessary support to help children with ADHD reach their full potential. With early intervention, appropriate treatment, and a supportive environment, these children can lead successful and fulfilling lives. By working together and advocating for their needs, we can ensure that children with ADHD have the opportunity to thrive and achieve their goals. Effective treatment options. The most effective treatment for children with ADHD typically involves a combination of medication, behavioral therapy, and lifestyle modifications. Each child's treatment plan should be tailored to their specific needs, taking into account the severity of symptoms, coexisting conditions, and individual responses to different therapies. Here are the primary treatment options. 1. Medication. Stimulants such as methylphenidate, Ritalin, Concerta. These medications help increase dopamine levels in the brain, improving attention and reducing impulsivity and hyperactivity. Amphetamines, Adderall, Vyvanse. These also increase dopamine and norepinephrine levels, enhancing focus and reducing its symptoms. Non-stimulants such as atomoxetine, Strattera. This medication increases norepinephrine levels and is often used when stimulants are ineffective or cause significant side effects. Guanfacine, Intuniv, and Clonidine, Capve. These medications can help reduce hyperactivity, impulsivity, and improve focus. 2. Behavioral therapy. Behavior modification, positive reinforcement, rewarding positive behaviors to encourage their recurrence. Timeout, removing the child from situations that trigger negative behaviors to help them calm down and reflect. Token economies, using a system of points or tokens that can be exchanged for rewards. Parent training, parent-child interaction therapy, PCIT, teaches parents effective ways to interact with their child to improve behavior. Parent management training, PMT, provides parents with techniques to manage their child's behavior at home. Social skills training helps children learn appropriate social interactions, such as taking turns, listening to others, and interpreting social cues. Cognitive behavioral therapy, CBT, helps children recognize and change negative thought patterns and behaviors, improving self-control and problem-solving skills. 3. Lifestyle modifications. Diet. A balanced diet rich in fruits, vegetables, lean proteins, and whole grains can support brain health. Some children may benefit from eliminating certain food additives or allergens that might exacerbate symptoms. Exercise. Regular physical activity can help reduce hyperactivity and improve concentration and mood. Sleep. Ensuring children get enough quality sleep is crucial, as sleep deprivation can worsen the symptoms. Practical strategies for supporting children with ADHD. Supporting these children involves creating structured environments, implementing consistent routines, and using positive reinforcement. Here are some practical strategies. At home. 1. Establish a routine. Consistent daily schedules for homework, chores, meals, and bedtime can provide stability and predictability. 2. Create an organized environment. Keep the child's living and study spaces neat and organized, with designated places for essential items. 3. Use visual aids. Charts, calendars, and checklists can help children stay on track with their tasks and responsibilities. 4. Break tasks into smaller steps. Simplify complex tasks by breaking them down into manageable steps. 5. Encourage physical activity. Regular exercise can help children burn off excess energy and improve focus. 6. Set clear and realistic expectations. Communicate rules and expectations, and be consistent with consequences and rewards. At school. 1. Preferential seating. Seating the child near the teacher and away from distractions can help them stay focused. 2. Extra time on assignments and tests. Allowing additional time can help them complete tasks without feeling rushed. 3. Frequent breaks. Short breaks during long tasks can help children manage their energy levels and maintain concentration. 4. Clear instructions. Providing clear, concise instructions and checking for understanding can prevent confusion and frustration. 5. Positive reinforcement. Recognizing and rewarding positive behavior and effort can motivate children to stay on track. Collaboration between parents and educators. Creating a supportive environment for children with ADHD requires effective collaboration between parents and educators. Here are some strategies for fostering this collaboration. 1. Open communication. Regular meetings. Schedule regular meetings between parents and teachers to discuss the child's progress, challenges, and strategies. Communication tools. Use communication tools like emails, phone calls, and communication notebooks to share updates and concerns. 2. Develop a comprehensive plan. Individualized Education Program, IEP, For children who qualify, an IEP can provide tailored educational goals and accommodations. 504 Plan. For children who do not qualify for an IEP, a 504 plan can still offer necessary accommodations to support their learning. 3. Consistent strategies. Consistency across environments. Ensure that behavior management strategies and routines are consistent at home and school to provide stability for the child. Share successful techniques. Parents and teachers should share successful strategies and interventions that work for the child. 4. Parental involvement. Engage in school activities. Parents should participate in school events and volunteer when possible to stay engaged in their child's education. Support homework. Parents can create a conducive environment for homework and provide necessary support while encouraging independence. 5. Professional support. Consult specialists. Collaborate with ADHD specialists, such as pediatricians, psychologists, and counselors, to ensure the child receives comprehensive care. Teacher training. Schools can provide training for teachers on the condition to better understand the condition and implement effective strategies. Effectively managing ADHD in children requires a multifaceted approach that includes medication, behavioral therapy, and lifestyle changes. Practical strategies at home and school, combined with strong collaboration between parents and educators, can create a supportive environment that helps them to thrive. By working together, understanding the unique needs of each child, and implementing consistent and effective strategies, we can ensure that children with ADHD reach their full potential and lead fulfilling lives. If you enjoy this video, please give it a thumbs up, like and subscribe to our channel for more self-improvement videos. Comment below to tell us how useful you found this video. Remember to share on various social media platforms to reach a wider audience. Click the notification bell to get notified anytime we post a new video. Thanks for watching, see you in the next video.